I hit start with.
Are we ready to get started?
Go ahead.
Go ahead. All right. Well, hello and good afternoon, everybody. My name is Lisa Beth Doyle. I'm a registered dietitian and the manager of health and wellness at Always Health Partners. For folks who are new to this webinar series, our goal is to bring you informative, timely, and helpful topics to help you live your best life and to thrive. Today's topic is how lifestyle factors influence breast cancer risk and optimize health for survivors. And we're going to try something a little bit different today. We're going to do this as really as an information session with lots of times for questions and answers from our participants. If you would like to ask a question during the session, you can look to the bottom of your screen and you'll see a little Q&A box, and you can use that to put in a question, and I will get it to our presenters, to our experts today. So I'd like to introduce our presenters. First, we have Dr. Farah Shafi, who is Always Health Partners Deputy Chief Medical Officer. She leads Always Health Partners clinical programs, including medical management and medical policy, pharmacy team, quality management, and behavioral health. And in collaboration with our Chief Medical Officer, she works to advance our population health and value-based care goals. This is so our members have the support they need when they need it. And she's also a practicing clinician trained in obstetrics and gynecology. And joining Dr. Shafi today is Dr. Amy Commander. Dr. Commander specializes in the care of women with breast cancer. She is a medical director of the Mass General Cancer Center in Waltham, where she also serves as the director of breast oncology and cancer survivorship at the Mass General Cancer Center, also at Newton Wellesley Hospital. She is an instructor of medicine at Harvard Medical School. She's board certified in hematology and medical oncology, and a diplomat of the American Board of Lifestyle Medicine. We're really pleased to have Dr. Commander here today. She is well known for her compassionate care and passionate devotion to her patients. She has a strong interest in improving the quality of life and outcome for cancer survivors through important lifestyle interventions, including physical activity, diet, and mind-body interventions. She promotes healthy lifestyles for both her active treatment patients as well as those in the survivorship phase. And she has launched Paving the Path to Wellness, a 12-week lifestyle medicine program for survivors of breast cancer. And with that, I would like to turn this over to Dr. Shafi and Dr. Commander.
Thank you. Thank you, Lisa Beth. I appreciate that. Dr. Commander, thank you for taking time out of your busy schedule to meet with us today. I'm really excited to hear your advice on this topic.
Thank you so much. It's a pleasure to be here.
So I wanted to jump off with just a couple of questions, if you don't mind. We understand that October was technically Breast Cancer Awareness Month. We're now into November. Why do you think that this month is important overall?
That's a great question. And as a breast oncologist, I would certainly say that having a month dedicated for breast cancer awareness is wonderful. It brings awareness, the importance of research, screening, and so many ways to recognize our survivors. But of course, every month should be Breast Cancer Awareness Month. And that's why I'm glad we're doing this talk in early November, so we can ensure that we don't forget about the importance of breast cancer screening and all these other important initiatives.
That's great. I think it's important to recognize really every month should be Breast Cancer Screening Month. And but to your point, I think it's great that we do highlight it at least once a month. That puts this on people's radar. What are your recommendations regarding breast cancer screening?
That's also a really important question, and probably one of the most important messages of Breast Cancer Awareness Month, especially given the challenges we faced during the COVID-19 pandemic, where screening rates, unfortunately, were significantly down. So my message last month, and of course going forward to all women who are eligible for screening, is please take care of yourself and schedule that screening mammogram. We have so much data, really starting from the 1980s, that shows that mammograms significantly reduce mortality from breast cancer by catching a cancer early when it's more treatable and more likely to be cured. That's the ideal situation for our patients. So to all who are watching this, please get your mammogram and talk to your doctor about when you should start screening.
Great. And I think it's also important for people to recognize in the audience just that breast cancer screening, actually cancer screening in general, including mammography, is covered under the Affordable Care Act at no cost sharing. So it's really important that people do recognize that these are tests that are covered by their insurance plans and are available to them.
Definitely, that's such an important point. And there are, I think you were also alluding to, when should women start screening? When should women start getting mammograms? And it's interesting, we have so many wonderful medical organizations in this country who have established guidelines, and there is some variability in those guidelines. But I certainly would advocate that women starting in their mid to late 30s should really start having these conversations with either a primary care physician or gynecologist, just to kind of, based on the risk factors, family history, and other factors, to determine what age that individual woman should start screening, whether that's age 40, potentially age 45, or maybe even earlier if she has a strong family history.
That's very, very helpful. In terms of, I've noticed that screening rates have declined during the pandemic, and it's certainly something that we're worried about. So what are the steps that we can take to try to address the fact that these screening rates have declined?
That's such an important question because, since the spring of last year, all non-essential medical procedures and tests were suspended given, our efforts to fight the COVID-19 pandemic. Certainly in late spring, we started opening up again to do screening mammograms, and we're definitely catching up here in New England, but we still are not quite where we want to be. And there are many factors that still account for the fact that we haven't fully caught up with mammographic screening. And I know many organizations, in particular, the American Cancer Society, are launching initiatives to help educate people and really get them back to screening, which is so important. I think a really key one is addressing fear. I think a lot of us are still kind of like, I want to stay away from the hospital. That's where the sick patients are. That's where COVID-19 is present. And I think just addressing that concern and letting people know that there are so many safety protocols in place to make our patients feel very comfortable coming to the hospital for screening tests, including mammograms.
That's an important point. And I think really addressing the fact that people have a fear of COVID-19 that has persisted even into 2021. And do you feel like most of the cancer centers have made things easier for patients, more streamlined to be able to get in for their mammograms?
Certainly, I can speak to working at the Mass General Cancer Center and the Mass General Cancer Center in Wellesley, where I've been so impressed by the efforts our radiology colleagues have made to really streamline the process for mammographic screening. Woman comes in, gets her mammogram, it's very efficient, and then leaves and gets results usually that same day or the next day. And I honestly think, in my experience, from what I've observed, these protocols are even more efficient than prior to the pandemic and very safe. So I know when I got my own mammogram, I felt that the whole process was very streamlined, efficient, and safe. I was in and out and I got it done. That's
awesome. That's great. Have you noticed, I think getting back to that concern about the screening rates declining during the pandemic, and I suspect that it's too early to tell if we have adequate data on this question, but I'm curious if you've seen in your practice, in your colleagues' practice, have we been seeing more later stage cancers being diagnosed as a result that you think may have been the delay in screening?
Yes, certainly this is a major concern among oncologists and all of our colleagues. did this delay in mammographic screening, is it going to result in patients with later stage disease and potentially a poorer prognosis? And certainly, as you note, we're going to await further data to really answer that question. But anecdotally, in my own practice, I've definitely seen many women who did not get their mammogram last spring because it was canceled. And then maybe, it took a few months or more than a few months to get that test rescheduled. And so I am worried that some of these women maybe have a higher stage cancer than they would have had if they were able to get their screening as scheduled last spring. So I think that's a very, very valid concern, and we'll see what the data shows us.
And I think that's the whole rationale for really that every month should be breast cancer screening month, and breast cancer awareness month, and really cancer screening in general, that we should continue to keep up with those despite the pandemic.
For sure.
I think, just pivoting a little bit more towards risk factors for breast cancer. Can you speak to some of those risk factors and any concerns that the audience should be aware of?
Right. And that's another important aspect of Breast Cancer Awareness Month, to really provide education about risk factors for breast cancer. So some of these risk factors we really can't control, and those include being a woman and getting older. So that's, getting older is a blessing, but as we get older, our risk for breast cancer does increase. We know in the United States, each woman has a 1 in 8 or approximately 12% lifetime risk for development of breast cancer. So there are other factors that also play an important role. I think all women should be aware of family history on both the maternal and paternal side of the family. If there's a family history of breast cancer, ovarian cancer, and now even family history of prostate cancer at a younger age, pancreatic cancer, all these things are red flags, which might suggest that a woman might want to talk to her doctor about considering genetic testing and seeing if there may be, a mutation such as BRCA1, BRCA2, or other mutations that could increase the risk of breast cancer from a genetic standpoint. Other risk factors that we talk about are really related to reproductive factors, which is your area of expertise. And that's really sort of thinking about estrogen exposure over a woman's lifetime, the age when she started having periods, did she ever have a pregnancy, and if so, what age and how many, age of menopause, use of hormone replacement therapy, etc. So there are many factors that we take into account when assessing an individual's woman's risk for breast cancer.
I think that that's helpful. And I think also discussing the risk factors in terms of the genetic screening, it's important for people to understand that genetic screening, if you meet the criteria, if there's a strong family history or tendency towards breast cancer, genetic screening is covered by insurance as well. And so it's really just the, hopefully to eliminate some of that financial barrier that people may have in terms of the concerns over getting the testing.
Yeah, that's so important.
Are there steps that women can take to lower their risk of breast cancer? I think that a lot of people would be interested to know what those steps are.
Definitely. So certainly there's factors that we can't control, as we discussed earlier, but there are many factors that are in our control. And I think it's important for those viewing this presentation to be aware that there are things you can do to help reduce your risk for development of breast cancer and other cancers. Nothing's 100%, but there's still steps we can all take to optimize our health. And one great resource, which I would recommend that your viewers check out, on the American Cancer Society website, there's actually a guideline that focuses on diet and physical activity for cancer prevention. And there are really 4 key steps that are outlined in this guideline, which are important for all of us to know to lower our risk, not only for breast cancer, but for other cancers. So should I go through those? Would you like me to outline?
Yeah, that would be really helpful.
And certainly when I get to nutrition, I'm going to ask Lisa Beth to chime in. But the number 1 risk factor, which is a challenge in this country, is to achieve and maintain a healthy body weight throughout life. And we know obesity is really on the rise in this country. And so this is a challenging one for many of us. And so it's something that we should all be aware of, that obesity is a risk factor for many different types of cancer, including postmenopausal breast cancer. The second factor that's really important is the role of physical activity. So, we all know we should get out and exercise a little bit each day, but actually that exercise also helps reduce our risk for development of a future breast cancer or potentially other cancers. And the guidelines really recommend getting in 150 minutes of moderate aerobic activity each week. And that really can be added up throughout the week. Maybe you get out and walk your dog for 10 minutes, 3 times a day, 5 times a week. There you go. That's 150 minutes. So, there's not a strict guideline that you have to go out and run for 2 or 3 hours to get it in. So I think that 150 minutes number is a really important one for us to focus on. We also really need to limit sedentary behavior. I know that's a major problem over the past 18 months. I'm in many Zoom meetings myself, but getting up in between meetings, walking around, going outside for a few minutes, these are all important to help reduce sedentary behavior. The next one is really nutrition. And Lisa, Beth, I'd love for you to chime in. The American Cancer Society really recommends following a healthy eating pattern at all ages. And while I could talk about it, I think it's better to hear from the nutritionist. So why don't you share your recommendations about that?
Sure, and thanks for including me. So what I'm going to say is probably not going to sound shocking to most people. Eating a diet that's called plant-based diet, which folks have probably heard a lot about, eating a lot of vegetables, fruits, whole grains, really basing your meals around those foods, including beans is good. Nuts can be healthy in a diet. Those are all really helpful to include. I don't usually talk about specific foods because really eating just a variety of foods and getting in all the different nutrients that they have to offer is really incredibly important. There is some limited evidence around apples and tomatoes. And if you like those foods, by all means, include them, add a little more, but please don't take this as a dying exclusively on apples and tomatoes, just two things to include, especially if you do like them. So those are really good to include. A little bit of lean protein, particularly from fish, from poultry, some low-fat dairy products. Those are really good for you. Something to limit, not just for breast cancer, but for cancer prevention overall, would be red meat and processed meats. And if anyone's confused about red meat, something that was simple for me to understand is that red meat comes from mammals. So if it comes from a cow or a pig or lamb, sheep, those are all red meats, whereas things that your proteins from birds and fish are certainly safer for you. So those are all really good. I know an eating style that's been in the media a lot is the Mediterranean style diet or the Mediterranean style eating. This is very healthy as well. One main difference that we may talk about when we talk about overall health, heart health, et cetera, and preventing breast cancer is that alcohol is generally, I don't want to say encouraged, but regular alcohol is considered okay for folks who are following that Mediterranean style diet. But alcohol is a risk factor for breast cancer. So particularly if you're at higher risk and you're concerned, that would be something to really limit or avoid if possible. That said, just final thought is outside of the alcohol, what I've really learned over the years is that healthy eating is healthy eating. What's good for your heart is good for your brain, is good for cancer prevention. So I think it's important to know that you don't have to have conflicting thoughts about what do I need to be eating for this condition or that condition.
Great, that's very helpful.
Thank you.
That's great. Thank you so much for sharing those tips. And you touched on the fourth factor already, alcohol. I know this is a topic that, we have to address. Alcohol is a risk factor for breast cancer and other types of cancer. So if we were going to be very strict, we'd say really eliminate alcohol altogether, but we recognize that that's a challenge for many people. So for women, it's really recommended to have no more than 1 alcoholic beverage per day. And I think that's really, really important to focus on. So those were the 4 guidelines. Again, healthy body weight, physical activity, a healthy diet pattern, and limiting alcohol. And then another key factor outlined on the American Cancer Society site is the role of community action. So a lot of these behaviors are very much influenced by our local communities, who we spend time with, how we can get to a grocery store nearby, et cetera. So thinking about these things at the community, both local and national level, are really important as well.
And we do have one question that just came in about supplements. Are there any particular vitamins, proteins, anything that have been shown to be helpful, or is this not important when it comes to breast cancer or cancer prevention?
That's a great one. And I can start off and then I welcome your thoughts too. But certainly there are no supplements that can prevent cancer. I think that's my main message. As you outlined with all the wonderful fruits and vegetables out there that we can eat, that's really where we should get our nutrients from, eating real food, whole foods with a focus on a plant predominant diet. I would not recommend supplements for cancer prevention. Lisa Beth, please chime in though.
No, I agree. I generally do not recommend supplements. For some people, if you're concerned you're not getting really what you need, some basic multivitamin can be a good thing to include. But again, I recommend that people speak with their provider if they have questions about specific supplements for them, or if they're not getting all these things in their diet.
I will add, thank you. I will add one thing that just came to mind, since we do live in New England and we're entering the winter months. Winter is coming. Vitamin D. So many of us who live here, we are deficient in vitamin D. Look at me, I'm very pale. We don't get a lot of sun exposure, which is a main source of vitamin D. So many women probably should be taking vitamin D, but that's for many reasons, not just for cancer risk reduction. There is some data that suggests that vitamin D may play a role, by the way, in the etiology of breast cancer. But we know vitamin D is so important for bone health in particular. And certainly, Farah, you can comment further on this. So vitamin D is one that we probably should be taking, but not just because of thinking about cancer prevention.
Yeah, that's an important point. I think just given where we live and the fact that most people are vitamin D deficient, but yeah, but I would agree with that.
I can't remember the exact months, but certainly in those winter months, the sun is just not at the right point in the sky for our bodies to be producing vitamin D.
Right.
Yes. Thank you.
Great. That was very helpful. I think just, understanding some of these avenues that patients can try to address if they're trying to decrease their risk.
Right.
Are there, for breast cancer survivors, let's say they go through the screening, we're talking about prevention, and then we're talking about breast cancer survivors. What are the steps that women can take to optimize health? And I think this sort of segues into that program, that innovative program that you have developed at your center. So I wanted to hear a little bit more about that.
Yes, as you know, this is a major interest of mine. And, when a woman completes her breast cancer treatment, it's very common in a clinic visit for the patient to look at me and say, okay, what do I do next? What am I supposed to do in terms of exercise? What kind of diet should I follow? Should I take supplements? As one of our participants just asked. There's so many questions our patients have. And actually, in the breast cancer literature, we do actually have good evidence that there are lifestyle interventions that are very important for our patients to help address strength, mood, reduce risk of lymphedema, et cetera, but also improve outcome. And when I say improve outcome, reducing risk of breast cancer recurrence. So there's really good data regarding physical activity, being at a healthy body weight, increasing data about nutrition. So all of these factors are really key. So as you noted, I'm very fortunate, actually now 2 years ago, working with my colleague, Dr. Beth Frates, I developed a program called Paving the Path to Wellness for breast cancer survivors. It's a 12-week program where we really look at evidence-based information to help our breast cancer survivors adopt these healthy habits to improve quality of life and well-being, and ultimately outcome from breast cancer. That's the goal.
That's great. And what is the feedback? I guess how many patients have flowed through this program, and what has the feedback been so far?
That's a great question. What was really unanticipated when I launched this program 2 years ago, which is hard to believe, and now it's virtual because of the pandemic, as we've discussed, an amazing community has really formed amongst these women. And that was not the goal of the program. But when you bring a group of women together who have just been through something as difficult as breast cancer treatment, and then you're providing education on these topics, there's obviously a lot of sharing going on and a wonderful community that's formed. And I would say one of the most amazing aspects of the program is these women who have been through it are continuing to meet together as a group on their own, over Zoom or perhaps outdoors in a safe setting, and really support one another in making these healthy behavioral changes. So I'm so inspired by that. So we definitely want to keep growing and offer it to more women as time goes on.
That's great. And I think that we're all gonna, given the statistics with breast cancer, I think we're all gonna know somebody that has been affected with it. And I think that speaking about lifestyle changes in survivorship, but also addressing the lifestyle changes for prevention are very important. So that's really helpful. And that's great that you've established that program and that it's been so successful.
Thank you. It's definitely a team effort and it's been very rewarding. And I'm so grateful to all the women who participated so far.
I guess I wonder if there's anything else that you might want to add regarding breast cancer screening.
Right. I mean, I just would like to make that point, even though it's not October anymore, that all of us really should be our own best advocates in terms of our health. And particularly for women, we're also busy taking care of everyone else in our lives, juggling so many things. But think of that mammogram as a form of self-care. This is something you need to do for you to improve your own health. And so you can continue taking care of everyone else and doing all the things that are important to you. And so that is really my primary message for women, that please take care of yourself and get your mammogram.
Yeah, I think it's a very important message because as women often do, they don't take care of themselves. And just that there's always a barrier or concern, the time that you have to take to go get the appointment, the financial barriers, the access issues. And I think that it's really important to just make the time, get it done, and at least you've considered yourself doing something important for prevention. We have a couple of questions, so I wanted to go ahead and get to those. Any recommendations for older people who are going under chemotherapy for an early stage breast cancer?
Right. So chemotherapy is certainly tough no matter what age you are. And certainly for our older patients, chemotherapy is a challenge. And I think it's important to have a wonderful healthcare team. That's number one, but also a great support network. Friends and family want to help you through your cancer treatment process, whether that's bringing meals, helping with transportation, or other errands. So let people help you. It's good for you and it's good for your friends and family who want to provide that support. So that would be an important message I'd like to share.
Great, thank you. And I think I have another question here. Why do the doctors suggest putting you into menopause after breast cancer? And I think that's more of a clarifying question regarding the effects of treatment, I suppose.
Right. So that's a great question. And certainly, as I discussed earlier, when we talked about some of the risk factors for breast cancer, many breast cancers are actually related to the female hormone estrogen. So estrogen, which all women have in their bodies, can increase the risk for development of breast cancer. And therefore, many breast cancers are what we call estrogen sensitive. And part of the treatment is blocking estrogen in the body or lowering levels of estrogen. So for some of our younger patients, blocking estrogen or lowering estrogen may actually mean early menopause. And that is a challenge for many of our patients. And we do everything we can to support them through that.
Great, thank you. I think that that's all of the questions that I have. I don't know if you have any other last minute takeaways regarding this topic.
I think this was a really great opportunity to discuss so many issues. So thank you so much for that opportunity. I know your team is going to share some resources at the end, which are great and help our listeners with additional educational options to learn about some of the things we talked about. So I would definitely recommend that viewers check out those resources.
Perfect. Thank you so much, Dr. Commander. I really appreciate this opportunity for you to come in and speak a bit about lifestyle factors and breast cancer prevention. I know this is a topic that's really important to us as a health plan, very important to me as a women's health provider. And these are some of the resources that we can share. The American Cancer Society website, as well as the CDC, the American Institute of Cancer Research, and then the guidelines for physical activity for Americans. I think that's an important one.
And Dr. Commander, we had one more question that just popped in at the last moment here. This says, fear is certainly not the only, excuse me, I'm not getting this out right. Fear is certainly not the only motivator. That said, are there common or widely known metrics for survival or success based on early detection? Are there metrics that can be shared to drive and motivate screenings?
It's a great question.
That's a great question. And I think we chose not to show a lot of slides in this presentation to keep it more interactive, but a really powerful slide is one that depicts the year we started in this country introducing mammographic screening, which was in the 1980s, and showing essentially mortality from breast cancer from that time until now. Mortality means dying from breast cancer. And I can honestly tell you, if you look at that graph from the late 1980s until now, there's been a 40% reduction in dying from breast cancer since mammograms were introduced. 40% reduction in dying from breast cancer since mammograms were introduced. So I think that is really important. And that's why you hear that saying early detection saves lives. And that's why.
That's great.
Great.
Very helpful.
Great. And I have a couple more if folks can stay on for a moment. I have one question about, do you know of any natural options instead of taking tamoxifen for 5 years post lumpectomy and radiation?
So certainly the standard of care treatment for an individual with an estrogen-sensitive breast cancer would be to take either tamoxifen, which blocks those estrogen receptors in the breast tissue and in the body, or a class of medications called aromatase inhibitors, which lower estrogen in postmenopausal women. So those are really standard of care treatment options that should very much be explored with a woman's oncologist. Certainly these other lifestyle interventions I see playing an important role, but they're not a substitute, a pure substitute for taking those medications. So that individual should really discuss concerns with her doctor.
Great. And then one more about the role of stress reduction and or meditation. And are these helpful for folks either in prevention or living a healthier life post-diagnosis?
Right. So we know that there's really nothing scarier than being told that you have a cancer diagnosis, and this causes significant distress and anxiety among our patients. And there is an important role for interventions that can help manage stress and improve resilience during and following cancer treatment. Fortunately, at MGH, we have a wonderful program called the Stress Management and Resiliency Program offered by the Benson Henry Mind Body Institute, and many of my patients have derived benefit from this program. And certainly there's improvement in mood, quality of life, decreased anxiety. So I definitely recommend that the individual who posed this question look into a program like that.
Great.
Wonderful. Thank you. All righty. Well, thank you so much, Dr. Commander, Dr. Shafi. This has been really, really great information. I hope the folks on the webinar today have come away from our discussion with a better understanding of things we can do in our everyday lives to help prevent cancer. Also resources that are available for breast cancer survivors. I do want to let folks know that if you're an Always Health Partners member, we do offer a number of resources to you at no additional cost, really around the healthy lifestyle. So we have a Healthier You program to help with weight loss and getting more physical activity. We offer tobacco cessation and some general health coaching to help you establish and stick to new healthy habits for yourself. If you wanted to connect with anyone in one of our internal programs here, you can simply email healthandwellness@alwayshealth.org or call the customer service number on your ID card and just ask to speak with a health coach. And then we will be sharing some of these resources that you're seeing on the slides here, so you don't have to write them all down now. And just keep an eye on your email for a link to the recording that you can share with colleagues and friends, again, along with our resources.
Great. Thank you.
You.
Thank you.